Borderline personality disorder. Borderline personality disorder, or BPD, is a mental health disorder characterized by instability of sense of self, intense relationships and feelings, and fears of real and perceived abandonment. The disorder is usually diagnosed in early adulthood and is most serious in young adulthood. Researchers are also unsure of the direct cause of BPD. BPD is a cluster B personality disorder. There are 10 personality disorders and 3 clusters of personality disorders. Cluster A is odd eccentric, like schizoid or schizotypal personality disorders. Cluster B is dramatic erratic, like BPD, antisocial, and narcissistic personality disorders. Cluster C is anxious inhibited, like avoidant or obsessive compulsive personality disorders. There are 9 characteristics to BPD classified by the DSM-5. These characteristics are feeling empty, quickly shifting emotions, most commonly extreme sadness, anger, and anxiety, a constant fear that the people the person cares about will abandon or leave them. Most romantic relationships are described as intense but unstable. The way the person feels about the people in their life can dramatically change from one moment to the next, sometimes seemingly with no cause. Participating in dangerous or unhealthy behaviors, such as driving recklessly, having unsafe sex, binge drinking, using drugs, or going on spending sprees. A history of attempts to hurt themselves, engagement in self harm behaviors, or threatening or attempting suicide. When feeling insecure in a relationship, the person tends to lash out or make impulsive gestures to keep the other person close. And lastly, an unclear or shifting self image characterized by frequent changes in appearance, values, or personal identifiers. To be diagnosed with BPD, you must fit 5 of these characteristics. Some of these characteristics may sound familiar. You personally may have struggled with a few of these things, but the biggest factor to remember is that people with BPD have these issues pervasively throughout most of their lives. These may also sound familiar because some symptoms overlap with a more commonly known disorder, bipolar disorder. However, it's important to note the biggest differences between both BPD and bipolar. BPD and bipolar are characterized by mood swings, but the frequency, length, and cause of these changes are different. With bipolar, mood swings can happen without reason, last for weeks or months, and are mostly extreme excitement or extreme depression. With BPD, most mood swings are usually responses to situations, last for minutes or hours, and are mostly intense anger or sadness. BPD can also be misdiagnosed and hard to treat since BPD often has comorbidity, which means it's diagnosed in tandem with other disorders. So it can frequently be mistaken for other disorders. It's most commonly misdiagnosed as depressive disorders, like depression, or bipolar. Additionally, it can be diagnosed in conjunction with other personality disorders, but should be given its own diagnosis. And lastly, other disorders should be ruled out because medical conditions, like brain injuries or infections, can mimic BPD. Treating BPD is arguably the hardest part of the disorder. Medications can assist symptoms of BPD, but the only reliable way to see improvement in BPD symptoms is through therapy. BPD can be very hard to live with. The disorder comes with a lot of instability and turbulence. Frequently, therapists do not want to work with or will fire patients once they are diagnosed. Many BPD individuals need extensive therapy and sometimes need inpatient treatment. But BPD is not a life sentence. While many of the symptoms can be very hard to treat and require much self work by the BPD individual, over time, the symptoms lessen and can become more manageable. A specialized approach in therapy and understanding oneself can help dramatically reduce BPD symptoms.